One of the points that has been made several times over is that there are significant differences between patients in small, sometimes rural community hospitals and patients in academic medical centers. I wonder if you could just reflect for us the legislature's thinking about the differences or the potential differences between patients in academic medical centers, tertiary and quaternary care patients, versus patients in community hospitals, so that we can better understand the testimony we're hearing.
I don't know if anyone else has a point on this, but my belief would be that I think it would be easy for the larger hospitals to, or I should say the smaller hospitals, to sort of present a case where there may be issues around staffing. But I believe as the bill was presented and as we voted on it, there did not seem to be, in my recollection, any splitting off of different size hospitals relative to what the actual care limitations were going to be. So it is one-to-one, and that's the very clear language. If there was an indication or a wish for it to have been differently laid out for the smaller hospitals, that did not become part of the current language that we're dealing with.
Anyone else in the delegation want to comment or make a particular remark?
I think, the Representative Naughton, this wasn't done in a vacuum. This vote wasn't done in a vacuum. It wasn't. Our process is often criticized as being slow and too deliberate. I don't think it can be too deliberate. That was the way the Founding Fathers set it up well over 200 years ago. It's been followed in many instances around this country and around the world. So this piece of legislation didn't just come to the floor and it was feel-good legislation because, none of us are nurses, but we've all been cared for by nurses over the course of our lives. This was a piece of legislation that came through Public Health Committee, Healthcare Committee, Healthcare Financing, and Ways and Means. So it was done deliberately. So the issues that you're alluding to here have all been talked through and talked about and debated both at the committee level and on the floor level in both the House and the Senate. So these things were taken into account, and as Chairman O'Day has told us, it was decided after much deliberation to not distinguish between sizes of hospitals. That would be the easy way out. If there's, it would have been a slippery slope at that point. So this was not done in a vacuum.